Hello everybody and welcome to Gynae Cancers with the Butterfly Princess and Helen. This is our final episode in this mini-series where we've been talking about the 5 different types of gynae cancers. So we've spoke about 4, and today to end the series we're going to be talking about vaginal cancer. This will be an overview of what vaginal cancer is, prevention, symptoms and things. And then I thought it would be nice just to end with a quick overview of everything that we've been discussing in this series. I hope you've all found this series really educational and informative, and I hope that anyone out there, if you've experienced symptoms of any of the gynae cancers Helen and I have been discussing, me and Helen really hope that through this series you have been able to gain the courage to seek medical advice or seek advice, because as we all know, that you know your own bodies, you're an expert in your own body. So the important thing is that if you think that something in your body isn't quite right, then you need to speak up and go to a medical profession to go and say there's something not right here. And we hope that this series has given you the courage to do that. So, hi Helen, thank you again for joining me.
Hi Steph, it's lovely to be back.
Yeah. So vaginal cancer, what is it like? Firstly of all, we talked about the vulva cancer last time, and we talked about, how people can often get confused between the vagina and the vulva. So could you just explain where the vagina is and what its function is? And
Yeah, of course I will, Steph. So absolutely. So people do get confused between the vagina and the vulva. And the easiest way to remember it is the vulva is on the outside. So our vulva is on the outside. So it's what we can see between our legs where our pubic hair grows, and where our lips are. And when we pull those lips back, and everything that we can see in that area is the vulva. Okay. People quite often say, oh, I've got vaginal itching, or I've got lumps on my vagina. We actually can't see our vagina. Okay, so the vagina is a muscular canal. It's inside, and it connects the outside of our body where our vulva is to our cervix, which, as we know, is the neck of the womb. So when we open our vulval area, we can see the opening to the vagina, but we can't see actually inside it. And the vagina is where, when we have a period, the lining of our womb is shed through, and also the canal where a baby comes out when you give birth.
yeah, so
yeah, sorry Steph, go on.
So again, what is vaginal cancer? Although it's quite rare, it's still important to raise awareness of.
It absolutely is, and you're right, it is very rare. It's the least common of the 5 gynae cancers that we've talked about, and there's about 250 people diagnosed every year with it, but only 1 to 2% of the 5 gynae cancers are caused by vaginal cancer. It's more common in women over the age of 65. There's about 40% of over 75, not 65, over 75. It's more common in women over 75. About 40% of cases diagnosed are in those over 75. But anyone with a vagina can be diagnosed at any age. So I guess the next question is really, how does it develop? So, like cervical cancer, it's very strongly linked with the human papillomavirus, the HPV virus. So 75% of vaginal cancers are linked to HPV. And there's different types of vaginal cancer, but the most common type is what we call a squamous cell cancer. So that affects the skin cells of the vagina, and it may look like little lumps or ulcers. And then there are other cancers which are about 1%, 1 in 10 of them, which are caused by what's called an adenocarcinoma. And that's a cancer that affects the glandular cells, so the cells that produce mucus inside the vaginal canal. And then we have other rare types, which are extremely rare. So the signs and symptoms that we look for aren't always obvious, but it's that thing, as you said, Steph, it's that thing about knowing your own body, and if something isn't right, getting it checked. So about 20% of patients don't have any symptoms whatsoever, but the most common changes that we would be looking out for are, again, that unexpected vaginal bleeding. So whether that's after sex, in between periods, after the menopause, any unexpected vaginal bleeding when you're not expecting it, always get it checked. Any vaginal discharge that smells or that is stained with blood, any vaginal pain during sexual intercourse, a lump that you can feel or that your GP or practice nurse can feel, a vaginal itch, so not on the outside, on the inside, that just never goes away. It drives you absolutely mad. Sometimes pain when going for a wee, and sometimes pain in your vagina. So it's not a pain that you can actually rub better because it's inside, and sometimes pelvic pain. So if you have any of those symptoms, it's always important to get them checked. And the chances are it's something other than vaginal cancer, but it's always so important to get them checked, because the earlier it's diagnosed, then the more treatment options that are available to you and the best possible chance of someone having successful treatment. So knowing your own body, knowing what symptoms to look out for, those are the key things.
Yeah, and so like what? Obviously, we can't prevent cancer from happening because any one of us can get cancer. But what sort of measures can you take to sort of decrease the risk of developing vaginal cancer?
Yeah, absolutely. So there's a few different things really in terms of the risks. There's a few key risks. So the first thing is that thing again about knowing your body and knowing any symptoms that are not normal for you. The second thing is we can't do anything about age, but the one thing that we can do something about is this human papillomavirus. So we've talked about this before, and it's a very common group of viruses. It's about 200 different types that spread through skin-to-skin sexual contact. And most of us, even after one sexual encounter, Steph, will come into contact with HPV in our lifetime. And usually our immune system will fight it off. But for some people, so maybe those who have a persistent HPV infection, or who have had a transplant, or who maybe take medication that suppresses our immune system, it can be harder to get rid of. So it's about having the HPV vaccine if you're eligible, and using condoms sometimes can reduce your risk. Now, there are other things in terms of things to be aware of. So if you've had, we've talked about when you go for your cervical screening and we check for HPV, and that might cause these cell changes. So if you've had abnormal cells in your cervix or abnormal cells in your vagina, then those are not cancer, but it's important then to be even more aware of any symptoms. That's the key with vaginal cancer, is to be aware of your symptoms, because they can be closely linked to the development and increase your risk. And then if you've had cervical cancer, if you've had womb cancer and had radiotherapy, if you smoke, we advise you to stop smoking because it's harder to get rid of the HPV virus. And as I say, if you've got a weakened immune system, if you had any of those things or got any of those things and you notice symptoms, it's so important to see your GP so that they can do the right thing and refer you on for further investigation.
It's been again really informative, Helen, and like I said, even though this series is ending because we've talked about all the 5 gynae cancers, me and Helen are still going to be collaborating in the future, because we've discovered through these discussions that there's so much more to discuss about in regards to cancer and the help out there and the HPV virus and stuff like that. So I suppose my final question to you, Helen, would be, I sort of summed it up from my perspective at the beginning, what I hope this series would want to achieve. But like, I know because of the work you do and you've had a cancer diagnosis yourself. So how could you sum up this series and encourage, many people who may be still wary of getting checked out, the importance of going and telling a medical professional that?
Yeah, absolutely. And I think, we've covered an awful lot in this series, Steph. And as you say, we are going to be continuing to work together and looking at other things, because it's such a vast area. But I think for me, you summed it up right at the beginning of this session, Steph. It is about knowing your own body. And I don't know if any of your your listeners have seen the news this week, but there's something called Jesse's Law, which has been brought about and has been in the news this week. And it's because of a young lady who very sadly had some symptoms, and she spoke to her GP, I think it was about 20 times in a very short space of time. She was very rarely examined, and unfortunately, when she was actually seen, she was diagnosed with a very advanced form of cancer, not a gynae cancer. It was so advanced they couldn't find out where it had started. But this law is encouraging, in its guidance, is encouraging GPs that if somebody presents with symptoms 3 times or more, and those symptoms are persisting or not improving, then they refer for further investigation. So I would always say to people, if there's something not right for you or different for you, start writing it down. Write down all your symptoms and write down what you expect from that GP appointment. When you go into that appointment, hand those symptoms to your GP so they know exactly what your expectations are, exactly what you're experiencing, how long you've been experiencing them for, and what you are wanting from that appointment. And I would say that's absolutely key. And that is crucial in terms of getting the right investigations and getting cancer detected early, and then improving the rates of a successful treatment outcome.
Oh, well, thank you very much, Helen, and thank you everyone for tuning in. It's been a delightful and informative and really educational, and I look forward to doing more work with you in the future.
Yeah, absolutely. Thanks so much, Steph, for having me. It's been a real privilege to be invited, and I look forward to continuing to work with you.
Thank you. Well, bye-bye, everyone, and thank you for tuning in. Bye-bye.